cervical and thoracic mobilization techniques you can do that work really well in modulating pain and improving cervical neck range of motion, as well as upper extremity range of motion and function. The first one we're going to do is you're going to take your hands kind of in this position here and go right at the top of the thoracic spine, right below that CT junction. What I'm going to do is have Kenzie take a deep breath in, and then as she relaxes out, I'm going to kind of sink in and just provide a little bit of a stretch there, kind of straightening out my elbows. I'm going to hold that. I can oscillate that. We're going to back off. She's going to take a deep breath in. Then she's going to go back out, and I'll move down a little bit in the thoracic spine, just a little bit of mobilization there. And I'm not manipulating. That's a grade 5 mobilization or manipulation. You can do that if your scope of practice allows, but in that case, I'm just working on just stretching those joints, providing that input. I'm going to show you another technique, kind of a cross hand technique here. So she takes a deep breath in and lets it all the way out. I do like this for a middle thoracic. I'm just going to kind of oscillate here. I can work down with this. Again, just kind of being easy, not pushing super hard. Let her breathe a little bit, and then we'll go back and repeat that, just kind of back and forth throughout the entire thoracic spine. Another way that I can go is from the top down or superior to inferior with this. I'm going to do that same technique, go right below that CT junction. I'm kind of pushing down towards the bottom of the mat here, kind of working in. I can go on her out breath with this. I can just work this and stretch this back and forth. I'm kind of oscillating. Not that hard thrust technique or that grade 5 manipulation, although you can do that. I'm also going to work on a little bit of CT junction. So I'm going to find that hard knot area back there, that C7, T1 junction, and I have my hand, like to use this side right here, and I'm pushing in so I have a hold of it there. You can also use your thumb. I don't like that. It's just not really comfortable for me. We go right on that CT junction, and then I'm going to take my other hand. I'm going to rotate her head to the right, and then I'm going to oscillate there. I'm pushing down and across a little bit. You can go straight across. That's fine too. And I'm going to oscillate there, and then you can go back and go the other way. Just a few great techniques for mobilizing the thoracic spine in that CT junction area.